All right, Dr. Emer, you're alive.
Hey guys, it's Dr. Emer. We're finishing up our acne scar treatment today. We already did some subcision and filler. You can see that here. It's all numb in this area and it's marked. We did a punch excision of a scar on her nose. Take a look, there's some stitches in there. And now we're gonna start with our microneedling radiofrequencies. So take a look, I wanna show you guys something. 4 millimeters, look at this. These needles can go deep into the skin. Can you balance it? Look at that. But we're not gonna go that deep in her face because we don't need to. We're gonna start, we're gonna feel a little bit, 1, 2, 3. This is the new Roar Pixelate device. This is going to give us some bleeding, you guys. This is going pretty deep into her skin to remodel the scars. We have nerve block. She has some of the subcision numbing in there. And this is gonna be the deep portion of her treatment. The superficial portion is gonna be our CO2 laser that we're gonna use in a minute to also really resurface and remodel her scars. Get all that blood, please. Dab it all. Yep, there we go. You guys can see how strong this device is. This laser goes really deep, or this radiofrequency microneedling goes really deep into the skin depending on your settings. We really want the area that I circled to be much stronger. So we're gonna do some overlapping pulses. You guys see we're not going as far. First step. And right now she's actually doing really well because we have all the nerve blocks in there. How is the pain? Thumbs up. Excellent. Thumbs up. Yes, well, you can't really talk.
We have some surgical questions coming to Emerald's skin.
What are they saying?
They're asking about facial surgeries, guys. Send us a DM, full name, email, phone number. We'll make sure our surgical team reaches out to you.
And here we are, doing this remodeling.
Some more questions for you.
Yeah, what are they saying?
If both work well on texture, when would you choose Fractora over Pixel 8?
Well, you guys need to consult with me so we can go over that. I will tell you that as new technologies come out, they're going to be more advanced. So Fractora is a little bit older and Pixel 8's a little bit newer. Plus Fractora, you have to push into the skin. I don't need to do this. This propels into the skin by itself. So this allows for less error in terms of the user.
So do you recommend a nerve block?
She's got nerve blocks already done.
Because we did that. If you guys stay tuned, we're going to do some CO2 next.
You guys can see, this is also going to give her a degree of skin tightening, but the goal for her is really the texture of her skin.
Get the added benefit of the tightening.
Right, so we're working to improve her scars, but we can go over the difference between different devices in a consult. So this side's basically done. Always like to do extra passes over the scarring area, especially with these sort of deep, irregular textured scars.
There's literally surgery to change the shape of a chin from a profile view, not make it projected, but change the shape.
Yeah, there's definitely many surgeries for that.
Guys, we got lots of options for you. You guys can definitely send us a DM. Full name, email, and phone number. Our team will reach out to you.
So now we're doing the other side, and you guys could see this is really strong. We're going very deep into the skin, but she's doing really well in pain because we have the nerve blocks. I want to shout out to my travel patients. She's a travel patient, so I appreciate you guys coming from so far. I wish I owned clinics everywhere, which I will in the future. Capital investment companies, you guys contact me so we could start doing clinics everywhere to help more people so I can train them.
Because we have many patients that travel to us, and we travel to some of our patients in New York and in Florida. If you're near one of those areas and you want to get an appointment with Dr. Emer, Make sure you send us a DM with your full name, email, and phone number. We'd love to book you. Those clinics, the pop-ups do fill up very fast.
And we prepped her with her skincare from Emerage Cosmetics.
And we ship it anywhere.
Yeah, we could ship it all over the world. So emeragecosmetics.com, you guys. We do lots of peels. We do skincare as everyday maintenance. But we have a whole prep for her skin. She did a peel and has skincare to prep her so we could do the CO2 with minimal risk. You guys see, look at the strength of the CO2. Or this microneedling radio frequency. We're gonna go to the CO2 next.
We've done lots of treatments today.
I know. Just being really meticulous as this is looking really good. Yes, thumbs up again. Another thumbs up from the gallery over there. We want success, guys. We want great results. Jordan gets very excited when he gets follow-ups of amazing results. Let me tell you how happy he is, even more than me sometimes. And I've been doing this for a long time. So you guys can see this Roar device is very powerful. We're really able to go pretty deep and do a lot with minimal risk. You guys can see the gold-plated needles.
Let me get a good clip of that. Let me focus on that. There you go.
See how it's propelling itself? So gold-plated needles.
Someone said, I have melasma. Is this treatment good for me?
Well, this one can be for tightening, but not for melasma. Can it be good? Is it good for the CO2? No. You cannot do CO2 if you have melasma. So you're going to need my Aerify from Emerage Cosmetics, my Aerify.
You guys are on the Emerage skin. You guys know what to do. We have plenty of Aerify on this account.
And we love Cispera. We love the anti-age brightener product. And there's a lot of other things we could do for melasma, like the peel that she did to prep, a Cosmelon or an Enlighten peel. My Aerify is a maintenance. So that's basically that for the microneedling RF. I'm just going to make sure we got everything. And now we're gonna go to the CO2. So what are we gonna do? Just gonna put a little more numbing on her cheek here. And then we're gonna wipe off her forehead and we're gonna start there. Perfect. So take a look, you can see all those dots. That's the Roar Pixel 8. So we're gonna wipe off her forehead, we're gonna put on her cheek. And we're gonna start up here. Let the cheeks sit a few minutes. We're gonna get her really dry because the CO2 attracts water, and so if there's any oil or water, let me cover your eyes, lift your head up for me. No, like lift it, there you go. Go ahead and lay back down. Perfect. We're gonna get my bubble goggles on. Take a look, bubble. My B goggles. We're gonna clean her off, and we're gonna get ready. Now we're ready to go. Let's hit the suction. Top pulse. So now we're going to do CO2, you guys. We're going to do it not with this little baby. Not with that little baby. Look. Look at that. It's so little. Look at that. Okay, now we need to go a little bit bigger. Okay, now let's take a look. Here we go.
That's a good spot size.
All right, so we're going to start up on her forehead. Here's not where she has his bad scars, so we need a little more wiping, a little more alcohol. It's too dry, too oily. Also need two. Hold on. Yeah, I'm gonna get super dry. Move back a little bit. There we go. Okay, my lady. And the other thing I want you guys to see my innovative optic goggles. There we go. You guys could see, take a look, you see my Innovative Optic and Jason Emer goggles. If you're a provider, amazing company.
And if you're filming these treatments, the lasers, they do make filters for that too.
Exactly.
So you don't damage your phone, you don't damage your camera.
And you guys could see it really fits over the eye and protects her eye. It's delivering a lot of power. How are you doing on pain? Are you okay? Mm-hmm. Okay, good. So you're doing really good. We have the nerve blocks in there. We did a little extra topical. We're blending into the hairline so it's all even. This will not damage the hairline. I'm gonna go to the other side, and then you can wipe off the cheek on the red, right? You can go start wiping the cheek there. So now we're gonna keep going. This middle area will feel a little bit, because there's no, I know, there's no nerve there, no nerves right there. So take a look, you guys. This is the scanning. Look at the pattern, really keeping everything as even as possible. Doing slight overlap. Okay, turn to the right. Perfect. Doing really good, you guys. And this is going to cause the skin to peel. This is a much stronger treatment. Are they saying anything there?
Lots of people are amazed. We have a lot of our skincare viewers on this account.
And you guys know we use all of our skincare line to help healing. You okay? You okay? Okay, turn left. Turn left. We're gonna go here now, on the side. There we go. It's not dry enough.
Alright guys, see all those little spots right there? These are all going to peel and reveal fresh skin.
Okay. You're going to feel a little bit as we get a little closer.
Why are those blood vessels popped?
Which ones?
Which ones, guys?
I don't see any. There's blood there because we did the pixel, but that's not any popped blood vessels.
We did our microneedling radio frequency beforehand. We did some Bellafill, and we did our subcision as well. If you guys like what you see here, I urge you to follow the medical page, Jason Emer MD. We post a lot more of these acne treatments on there.
And this is we're gonna be able to see her transitioning. I'm going to wipe the other side. We're gonna see her transitioning over the next week. You'll really be able to see a big change as she peels. Doing good. You guys see, we're really following a meticulous pattern. Almost done on the side.
People are saying how painful it must look, guys. We have numbing medication, guys. We take care of our patients. We don't want them to be in discomfort for this treatment.
It's not the best in the world. Most people say a 3 to 5 out of 10. She's doing really good. This side's almost done. Just a few small areas. She's doing really good. Gonna blend. Good. And bring your head straight now and do around your mouth. Our goal is to get as much improvement as we can in her scars, but I always tell people scars take a combination and a lot of maintenance treatments, regardless of how much you do. And even a large CO2 like this, I would only expect 20 or 30%, maybe only 20%.
Would you recommend this procedure for
Right?
people of color?
No, you guys know you can't do ablative lasers on dark skin. Maybe a little tighter. Hold on. You can't do ablative lasers on dark skin, guys. The goal is to do what's safe. Ablative lasers on dark skin can cause hyperpigmentation. So we have to do other options. Now, potentially we could do other devices, so we would have to see you. So how do you make a consultation?
Guys, for that consultation, send us a DM, full name, email, phone number. We'll gladly reach out to you.
And this is a fractional ablative. This is fractional CO2. But by overlapping, you're getting a little bit higher density. Doing really good. Turn to the right a little bit more. There you go. She'll be about 5 days of peeling. And in the next few months, this will really improve. We got to do another treatment about 6 to 8 weeks later. You can wipe up her nose. Keep your head straight. Now, so doing small areas just around that punch. All right, let me see the middle part again. Want to make sure we were able to hit all the different bigger scars. So blending. shed those deeper scars, and we're done. So just blending. Making sure everything's even throughout. And we're complete. So with her skin type, we have to be a little more cautious. All done. We have to be a little more cautious with our density. But you guys can see all the areas. And now we're going to use her PRP and get that on her skin. Take a look. You guys can see this is her golden growth factors. These are inside her own blood. And we're going to use this to help her heal. And this will help improve all the redness, the swelling. It will go all into the little columns that were created by the laser and help her heal much more quickly. We pioneered this years and years ago. Okay, don't worry. And then we're gonna let her cool, and she's gonna follow our skincare protocol from our Cosmetics, and that'll be it. Her ear, and that's all. And that's it. That is doing a full acne scar treatment with our microneedling RF and our CO2, guys. Have a good night.